So 10:15 a.m.
Have you taken the COVID-19 vaccine yet? If so, how was the experience? If not, why not? This Sunday, Garth and Natasha talk about vaccination with you. And then, from 11 a.m.,
COVID-19 Conversations with PAHO. What is COVAX?
we welcome PAHO WHO representative Dr. Erica Wheeler to discuss the COVAX facility and ACT Accelerator, a global collaboration to enhance the development, production, and equitable access to COVID-19 testing, treatment, and vaccines. If you still have doubts about the vaccine, you don't want to miss Eye on Dependency this Sunday at a special start time, 10:15 a.m. Listen live on I-95.5 FM or watch live on the Eye on Dependency Facebook page or YouTube channel. Eye on Dependency. We don't just share stories, we change lives. Tell someone.
This is Eye on Dependency with Garth and Natasha. Sundays at 6:15 p.m. on the most influential name in radio, I-95.5 FM.
Take it. If you see the woman, take it. She sit down her back and take it. She tell me she able, pretending it don't. She start to smile, take it just for a while. Take it, let you know she able, pretending it don't. If you see the nurse, she come for it first. Not to take this vaccine, it could be a curse. Of course, as a first responder, her priorities in order. What more hesitate? Girl didn't want to wait. If you see the woman, take it. She sit down her back and take it. She tell me she able, pretending it don't. She start to smile, take it just for a while. Take it, let you know she able, pretending it don't. I take a took it. She take one jump, I went back for a next jump. She take one stick, I come back cause she love it. She take one shot, I went back for a next shot. She take one stick, I come back cause she love it. A young woman friend, they can make the grade. They say not me and that, this is a charade. But besides a little swelling and a little dizzy feeling, she had me a mess, thinking about her for this. If you see the woman, take it. She sit down her back and take it. The woman, she able, pretending it don't. She start to smile and take it just for a while. She take it, let you know she able, pretending it don't. I take a jump, she take one jump, I went back for a next jump. She take one stick, I come back cause she love it. She take one.
Good morning, Trinidad and Tobago's. Always a weird feeling saying good morning on our dependency, but here we are. Morning to you all. Good morning, Natasha.
Good morning, God. Good morning, Trinidad and Tobago. Great to be here. We're talking about something very important, something very topical. It's all the rage. It's the buzzword of the day, the vaccine.
And we have Kerr with us here this morning. Kerr also has to make some adjustments. So Kerr is on the board as usual with us, and we're ready to roll this morning. Thank you very much for joining us, and please pass the word around. There are a number of people still not accustomed to us being at this hour. So,
yes.
And this topic today is very important. So let's tell you what we have in store for you. In the background, you're hearing the music of bass, and we're going to be using that during the day, during the program this morning, because he has a video as well with a youngster called Donnell. I'll get to that later, but I never knew about this youngster, and it seemed that he was very popular, Natasha. He passed away from the COVID-19 and complications thereof, and you know, it's sad to know that we've lost a lot of people. We lost servicemen as well in the last couple of days, police officers, sailors, and soldiers. The list is going on. And folks, this program this morning speaks to that, and it's very important that you tune in. We will have the head representative of Pan American Health Organization, World Health Organization here in Trinidad and Tobago, Dr. Erica Wheeler from 11. But we have a lineup for you, Natasha. You want to share the lineup?
Yes, we're gonna speak with some persons who have taken the vaccine because I think it's important for us to share the good news, so to speak, and let you know what they have experienced with registering and how they feel afterwards. Because we want to encourage people to take the vaccine. I mean, that is just one pillar of how we defeat this virus. So we're gonna hear from Hazel Brown, Derek Valley, Gillian Smith, Jared Wilson, and Roger Mohammed before we get to Dr. Wheeler. And again, we appreciate their giving of their time and sharing their experience because we feel that it is so important. As we had survivors of COVID on the program before, it's important for us to promote and to hear from actual citizens who have done the vaccine thing and are the better for it.
Yeah. So Roger is on the front line, so we will speak with him, and then after we'll close off with Mr. Gerald Wilson, former Commissioner of Prisons. And also, we have we'd have that video to show you that Base did with Donnell, young Donnell. That's the youngster who passed away. As I said, I never knew of the young man. I don't know his history, but he seemed to be have been real popular with I think maybe the urban crowd, and so he's in this video as well that Base did. So we'll feature that this morning, and we also have something that's hidden in plain sight, a video from the Ministry of Labor, and it has to do with child labor. So we have a little puppet show to show you where that they produced for you, the audience, to understand, the citizens to understand that child labor is a no-no, despite what the pandemic presenting to us. Child labor is still a no-no. And then, of course, we have 2 Venezuelans charged for trafficking with counter-trafficking unit, and other agencies collaborated, and they arrested and charged 2 citizens for counter-trafficking for human trafficking. We have, if you didn't see that, there we have those mugshots for you as well. And then, of course, at 11, we hook up with Dr. Wheeler via Facebook. She'll be on with us via Facebook. But to start the proceedings this morning, we have a short video for you on the history of pandemics.
Yes, it's a video that we shared before, but we thought it was worth repeating simply to put this current crisis that we are in, this pandemic that we are in, into context, and hopefully to, well, I mean, we can all play our part in preventing it from happening again, but it's important to know the history.
Yes, and remember, vaccines were created for all of these in the past, so this one is no different, and we're going to take you on that journey on the history of pandemics. I think it's the first time we're doing this, so showing this one. We were to show you last time, but we didn't get time.
Oh, okay.
So it's the first time. So if you want to see this, remember we're live on Independency's Facebook page, YouTube channel, or I95.5 FM, and also the page is shared on the I95.5 platform as well. So after that, we take a break and we come back and we speak with our first citizen and the question is simple: why, where, and how? Why you decided to take the vaccine? Where did you take it? How are you feeling now? Would you encourage the citizens to do the same? All right, so without further ado, let's go to that short video on the history of pandemics, just to get you in that frame of mind and to put the whole morning into context.
The World Health Organization has declared the novel coronavirus outbreak a pandemic. A pandemic is the worldwide spread of a disease. Throughout history, many disease outbreaks have ravaged humanity. Here's the list of some of the major pandemics that have occurred since the 20th century. The Spanish flu, or the 1918 flu, was one of the worst pandemics in the history. It killed around 50 million people across the world. Spain was one of the earliest countries where the epidemic was identified. Spain freely published early accounts of the illness as it did not enforce strict censorship of its press, unlike other nations. As a result, people falsely believed the illness was specific to Spain, and hence the name Spanish flu. The Spanish flu pandemic was caused by an influenza A virus known as H1N1. Due to unavailability of vaccine or antibiotics, the control efforts were limited to non-pharmaceutical interventions such as isolation, quarantine, good personal hygiene, use of disinfectants, and limitations of public gatherings. By the summer of 1919, the flu pandemic came to an end. The Asian flu was first identified in February 1957 in China, and it subsequently spread worldwide. The Asian flu was caused by a virus known as influenza A subtype H2N2 or Asian flu virus. The virus spread to the United States by June 1957, where it caused about 70,000 deaths. Around 1 million to 2 million deaths were reported worldwide. The rapid development of a vaccine against the H2N2 virus and the availability of antibiotics to treat secondary infections limited the spread and mortality of the pandemic. The Hong Kong flu was a global outbreak of influenza that originated in China in July 1968 and lasted until 1969 to 1970. The Hong Kong flu was caused by a virus known as influenza A subtype H3N2, also called Hong Kong flu virus. Although a vaccine was developed against the virus, it became available only after the pandemic had peaked in many countries. The Hong Kong flu resulted in an estimated 1 million to 4 million deaths. Most excess deaths were in people 65 years and older. Human immunodeficiency virus or HIV attacks the immune system. Scientists identified a type of chimpanzee in West Africa as the source of HIV infection in humans. Though HIV arrived in the United States around 1970, it didn't come to the public's attention until the early 1980s. Persons who are infected with HIV often die from secondary infections or cancer. Since the 1970s, 75 million people have been infected with HIV and up to 32 million have died. AIDS is the final stage of HIV infection. Now, HIV has become a manageable chronic health condition, enabling people living with HIV to lead long and healthy lives. Severe acute respiratory syndrome or SARS appeared in November 2002 in China. It is caused by a coronavirus known as SARS coronavirus or SARS-CoV. SARS is a highly contagious respiratory illness characterized by a persistent fever, headache, and bodily discomfort, followed by a dry cough that may progress to great difficulty in breathing. The World Health Organization has reported 8,096 cases of infection and 774 deaths so far. There's no specific medication available against the SARS coronavirus. The treatment is usually restricted to easing the patient's symptoms until the illness has run its course. A SARS patient is either quarantined or advised to remain isolated. The H1N1 flu or swine flu of 2009 was the first major influenza outbreak in the 21st century. It was noted for its rapid global spread, which was facilitated by an unusually high degree of viral contagiousness. The H1N1 influenza virus was first detected in the United States in April 2009. This virus was originally referred to as swine flu because its gene segments were similar to influenza viruses that were identified in pigs. Scientists developed a vaccine to protect humans from H1N1 after the 2009 outbreak. Now, there are antiviral medicines and vaccines available to prevent or treat swine flu. Middle East Respiratory Syndrome or MERS is an acute viral respiratory illness. The illness was first observed in June 2012 in Saudi Arabia. Soon, it was reported in 27 countries across the world. MERS is caused by a coronavirus known as MERS-CoV, which attacks the respiratory system. No vaccine or specific treatment for MERS is currently available. However, there are several vaccines for MERS in development. Treatment is supportive and based on a person's clinical condition. Ebola outbreak of 2014-16 in West Africa was noted for its unprecedented magnitude. The actual numbers of cases and deaths, however, were suspected to be far greater than reported figures. The causative virus was a type of Zaire Ebola virus known as EBOV, which is the deadliest of the Ebola viruses. Currently, there are no licensed vaccines to prevent Ebola virus disease.
You're listening to Eye on Dependency with Garth and Natasha. Reality radio at its best.
Stay at home. Stay away from people. You have been warned.
This is a public service announcement for the Vision for Wings Foundation and the Trinidad and Tobago Prison Service Inmates Debate Team.
Coronavirus, the world's worst disease. Hide in your homes, people, please. A disease taking many lives and spreading a lot of negative vibes. Symptoms like fever, making us weak. Nurses and doctors help we seek. It started in China, now the world is sick. Let us unite and find a cure quick. You will get fever, as I'm told, with a headache and cold. After that comes a cough. To get rid of it is really tough. I wear a mask but get problems of respiration. Now we all need social segregation. Muscle pain will come too. Let us immunize, both me and you. They said sneeze and cough in tissue. Let's take steps to tackle this issue. Wash your hands with soap and water. Don't forget to sanitize after. Please avoid going crowded places. I beg you, don't be one of those 1,000 cases.
Confused or worried about symptoms during the COVID-19 pandemic? If you only have a runny nose or are sneezing, you may have a cold or allergies. Have you lost your sense of taste or smell? Are you experiencing shortness of breath? These are common symptoms of COVID-19. Coughing, fatigue, and fever are all symptoms of both flu and COVID-19. If you have a temperature above 38 degrees Celsius or 100.4 degrees Fahrenheit, call your local healthcare provider or hotline for medical advice and ask whether you need a COVID-19 test. If you have any COVID-19 symptoms or are waiting for test results, stay home and isolate from other members of your household. Drink fluids and eat well. Always wear a mask if you're in the same room as others. If you test positive for COVID-19, follow your healthcare provider's advice. If at any time you experience a danger sign like difficulty breathing, chest pain, confusion, loss of speech or mobility, don't wait. Seek medical care immediately. Remember, you can prevent colds, flu, and COVID-19 by following a few basic precautions. Stay safe and protect each other. We're in this together. Know your risk, lower your risk.
COVID-19 Conversations with PAHO.
Your first line of defense is the immune system of your body. Whenever a foreign body comes in like a virus, your own body will make antibodies to try and attack and shut that virus down. That's the first thing that happens. So the stronger your immune system is, the better. That's the whole premise on which vaccines are done. It introduces something into your body that will cause your immune system to generate those antibodies that will recognize a virus if it comes into your body.
Get the facts. Vaccinate, live. A message from the Pan American Health Organization, World Health Organization.
Hello, my name is Raquel, a trainee inmate at HMP Drake Hall, Staffordshire, England, and you're listening to Iron Dependency with Garth and Natasha. Please, people, don't traffic drugs. The money is all that nice. It's not worth it.
Take it, take it, take it.
Right, thank you for staying with us. And we go to our first citizen who took it.
Yes.
And that's the vaccine we're talking about. So on the line, we have, you could introduce this guest.
Yes, we have Hazel Brown. And I hope she doesn't mind me saying this, but she is 79 years old and she does have comorbidities. Thank you for speaking with us, Hazel. Hearing us?
I'm hearing you, yes, but I'm talking to you on the phone, right?
Yes, yes.
Is there anything I should be looking for? Oh.
No, you're good. We're hearing you and you hearing us. That's all we need to know. I was just letting the listeners know that you're 79 years old and you have comorbidities.
Survivor. Twice survivor of
cancer, yes.
Yes.
So tell us why you decided to take the vaccine.
Well, I think it was a logical vaccine to take given the amount of information that I have. I think people make decisions on the basis of the amount of information they had. And I think I had enough information to feel comfortable about submitting my body to the Trinidad and Tobago Health Care Service for an important action like this, which I think was not only in my own interest, but in the interest of my family with whom I live, as well as my neighbors and my co-workers and other people in the public. So I think it was people have to make a conscious decision, but it has to be based on what information they have.
Right. And how did you go about getting the vaccine? Did you register, and what was that process like?
I went through what every citizen of Trinidad and Tobago goes through when you have to deal with the government of Trinidad and Tobago. First, they said you should go and you should call to register. So I did that. They took the information and said they would call me back. Of course, they didn't call me back. So I decided I will be a bit more assertive. So I went out to the health center in Diego Martin that I don't live far away from. And they took all my information again and said they would call me back. And of course,
they didn't
call me back. At which time I decided, this is the third time I'm going to try, and after that, I'm gone. Just as I was about to pick up the phone to say I'm calling a third time, please, I'm not calling again. Lady said, hold on. I hold on. Then she gave me a date. It was the first date, the Friday when they opened the Savannah Mass Center. And I have to say that I was very impressed with the level of organization that existed at that center. I was in and out of there in an hour. The thing about the vaccination and the decision that people have the thing you have to go through, you have to understand Trinidad and Tobago, there are three, in respect of this COVID thing, there are three sets of stakeholders that you have to deal with. The first one is the government and the politicians, and that is hopeless. There is on the other side a set of public servants who are marvelous. I think we have some of the best public service workers in Trinidad and Tobago in the world, but they have to live every day, I suppose, with the politicians. The other thing that you have to deal with is the Trinidadian person. God only made one set of Trinidadians, one set of people in the world like Trinidadians. They are disorderly, they are unruly, they are smart, they're not stupid, and they do the strangest things. Governing a place like Trinidad and Tobago is not an easy job for anybody because of who we Trinidadians are. And if you're making any judgments about the vaccination system, you have to take that into consideration.
Yes.
What government and governance we have, and we can't change them for another how many years. Those marvelous public servants who are out there giving their lives and their best to keep us all alive and well. and we Trini people. And when you put those three things together, you can get anything, you get any result.
So you took your first dose. Which vaccine did you take, and how did you feel afterwards?
The whatever.
AstraZeneca, yes.
AstraZeneca, yes. That is what they will be giving in the Savannah, in that mass center. And my next second shot date is Friday the 18th.
Right. Any side effects?
Which is the same date they had given me when I went to Savannah. So that system seems to be working.
Okay,
right.
Well,
Any side effects?
We could ask how you're feeling, but we can hear you're feeling really well. You sound strong.
As you know, at my age, I've been having vaccinations for a little while of all kinds. The one that I remember most was the polio one, where people were really scared that if they didn't get the vaccination, the outcome would be very serious. But this one has been and seems to be a little more serious than any of the other kinds of outbreaks of things that we have. But I've always had vaccinations because I travel a lot for smallpox and all kinds of things that I don't know about. And this year in January, I did in fact go and take my flu shot for the first time.
Right. Very good.
Okay, well, thanks very much.
Thank you very much for sharing.
There's one thing I want to say about this whole COVAX vaccination system is that every time I listen to one of those ministers talking about what they're doing, I want to scream, because those public servants, the nurses on there, have not had their contract renewed for 10 years. They are living and working at 2011 salaries. They are such great and marvelous and wonderful people, and nobody seems to be concerned about their short-term contracts that they're living on and the fact that they're living on wages of 10 years ago. And I don't know what I would have done if I was a public servant.
Well, thanks very much for that concern. It's out there, so I'm sure that they listened, and thank you very much for speaking with us.
Yes, thank you very much, and stay safe.
Right, that was his Brown and giving her take on the vaccine. Up next, we have Mr. Derek Valley. Hi, Derek. Good morning.
Hello, and good morning to you, Garth, and
yes.
your lovely wife, Natasha.
Morning.
Morning, Derek. So Derek, keep it simple, because we have other people to speak with. Why, where, and how? So why did you decide to take the vaccine?
Why? Because of the fact that for the last 30 plus years, having started from scratch, I built a business in Trinidad and Tobago. And from March last year to now, I've been unable to operate. Why? Because of COVID. So I had to actually make up my mind that the only way we're coming out of this thing is with herd immunity. Like I shared an article with you yesterday from Renee Cummings, showing that New York is back in terms of people are back out and they're able to operate. I'm operating in an international airport, and the airport has been shut since March. Most people may not want to take the vaccine, but the fact of the matter is, just like Hazel Brown said, everybody has to do their research, and I decided, hey, a lot of research went into this. It's looking like it's a solution to this problem. One cannot continue like this, because whether it's not only a health-wise, but economically wise, it's not making sense. The faster we get back out, the better. So I decided to take it. I took it about 2 weeks ago. I was fortunate enough that the Airports Authority, in their wisdom, reached out to some of the stakeholders and invited them to come and get the vaccine. The fact of the matter is, we have to get ready to get that airport back on track.
Right.
And this was part of the process.
Right. So how you feel now?
I feel full 100. Basically, it was a big decision for me because I didn't take it alone. My son and my daughter, who are also part of my enterprise, they actually came to take it. And the thing about it is, as a father, if you might take a risk, but when it comes to your children, you think twice, 3 times, 4 times, a million times. I'm sort of tired of the running around, who for, who against. I'm not holding it against anyone, because I said I'll wait till the last vaccine to take it. But sooner or later, you had to jump, and I decided now is the time to jump.
Right. Well, Derek, I know, as I said, as we all know, you operate several outlets in Trinidad and Tobago, but the airport I know is really close to your heart, and I know you and the other stakeholders can't really wait for the reopening of the airports again.
Well, let me stick in a plug here. I want to call on the Prime Minister. The airport has been closed for a year. The Airports Authority have tried their best, but it's time to have a discussion with the stakeholders who have been there, all these concessionaires who have been there. From March last year to now, we're talking massive loss. All right? A lot of people say businessman. A lot of people know me. Derek Valley built this from the ground up. The little black boy did it from the ground up. And now it's sad to see what it is. But you know what? I have faith. I have told people, I continue to mentor and coach people. Yeah, what's going on? In this downtime, use your time wisely. Instead of watching Netflix, go on YouTube, learn something, learn a course. We could build back this thing, right? But I'm saying, Mr. Prime Minister, please, a discussion with the concessionaires at the Airport Authority. A real discussion. It's time.
Thank you, my brother.
Thank you.
Yes, my brother, Derek.
Thanks
Thanks
very
a
much,
lot.
and stay safe.
Stay safe, my brother. Thanks for speaking with us. All right. So we have up next.
We have Gillian Smith Trumpet. Good morning, ma'am.
Hi.
Thanks for joining us. Tell us
Thank
first.
you for having me. You hearing me?
Yes, we're hearing you. So let's go through this quickly. Why, how, and
Why, where, and how?
Why, where, and how? Okay.
Yes.
Oh my God, I'm sorry about my dog.
So let me just want to hear you on the interview this morning.
Why this morning? Let me tell you. I'm always up to date with my shots, my vaccines, right? And it was my son who decided to call to have his entire family vaccinated. And my son is about 20 years old. So ever since I know myself, I've been a sickly person. So, I mean, at the end of the day, this is what we have to do in order to protect ourselves and to protect our families. So he decided, we made a decision, and I said, okay, I will take the vaccine. And despite hearing all the negative stuff and all the positive stuff, I just threw it out the window. I do not want to be a burden on my family in the event that I get sick. So I decided, let me take the vaccine. I took the Sinopharm. So far, the only thing I got was being tired a lot and eating more than usual in terms of the side effects.
Right.
Nothing major to talk about. And between you and me, I am still a little afraid, only because it's not FDA approved as yet. But at the end of the day, we still need to protect ourselves, and nothing is foolproof anymore.
Yep.
So,
how was the process to register to get it? Was that smooth?
You know what? I've grown accustomed to how people in Trinidad deal with things. So at the end of the day, he called. We didn't really get back a call. I told him to reapply again. That was about 3 weeks after. So he kept reapplying every week. And they eventually didn't call me. They called my husband.
Right.
And they just called him to ask him a couple of questions. And I told my son, reapply next week again. So I think we applied about 4 times? And I got a call eventually. And my husband wasn't on the list. I was on the list. And I asked them if they could have put him on the list when I was going to get vaccinated. And I also asked for the children as well. But they told me the children were too young. And it's just best that they do, him and I. So we got our first shot. And on Friday, we are going back for our second shot.
How you feel now?
To be honest, I'm a bit afraid.
But physically, you're moving around and everything.
Yeah,
is almost
good.
back
I'm
to normal.
good. Yeah,
Right.
yeah. And the fear is just the unknown. That is it.
The fear of the unknown. Understood.
Yeah,
That is understood.
that is all, you know. So, I mean, at the end of the day, we have our our human responsibility. But I mean, you can't force people to do things that they don't want to do, that they don't feel comfortable doing. This was my decision, my family's decision. And I mean, at the end of the day, it is entirely up to you. As they are saying, it does not prevent you from getting COVID, But it all depends on you too as the individual. You still have to take your vitamins. You still have to build your immune system. You still have to eat the correct foods for your body type, etc. So it's not just the vaccine alone. You have to make that decision to be healthy throughout the days, throughout the months, and throughout the year, to take care of your body and to take care of yourself, and the vaccine will help.
Thank you very much, Gillian. That's
Thank
very
you.
comprehensive and to the point. Great,
Okay.
and say hello to the family for us.
Yes,
Well
and
do,
stay
and
safe.
thanks again.
You're
Bye-bye.
welcome.
You too. Bye-bye.
Take care. All right. So that was Gillian Smith. And now we will have my boy Roger Mohammed on the line. And Natasha, so far.
Yeah, so far, I mean,
these
the
are the
main
hiccups.
the stumbling block is getting the appointment, and you know, that once people get over that, I suppose it's smooth sailing from there. We also had a comment from Nicholas Eiffel on Facebook. He says, "Good morning, Garth and Natasha. Thank you for this program. My wife and I took our first dose of the vaccine 2 months ago. The next dose is on the 23rd of June. I had no side effects." So it seems that there haven't been many side effects as a result of both vaccines, both the AstraZeneca and Sinopharm. So we hope that stays as is.
Right. So on the line we have Roger. And remember, if you're just joining us, you're listening to Independency. Just for this month of June, we are operating from this time until things go back to normal.
Yep.
You could find us live on the Independency Facebook page, YouTube channel, or I95.5. Bodyguard morning. Hello? Roger?
Mr. Mohammed, are you there?
Right. And we trying to link up with a couple of citizens who out there on the front line who would have crossed a certain age and decided they took the vaccine. And I remember coming up at 11, we have Dr. Erica Wheeler, that's the PAHO WHO representative here in Trinidad and Tobago, who will be taking us further into the vaccines, the COVAX facility, the ACT Accelerator. What is that all about? Well, you will find out from 11 when she joins us, when Dr. Wheeler joins us. So we're going to get back in touch with Roger, and we have him on the line now. Hi, Roger. Good morning.
Morning, God.
How are you doing?
Morning.
I'm all right. Morning, Natasha.
Right, my brother. So why, where, and how? Why you decided to do it?
Okay, why? No, you know I'm a police officer.
Yes.
The nature of my job and due to the exigencies of the Trinidad and Tobago Police Service, I have no choice but to be out there interfacing with hundreds of people. My initial impulse on this whole vaccination issue, I really was not going to take it. But I was not really forced, but strongly considered about 2 weeks ago taking a different view of this whole thing. Reason being, my wife and children are at home. I also have my mother-in-law at home, who's 84 years of age, and she's not in the best of health. And I am the only one in my household who is out here for as much as 30 hours every other day before I go home. So the level of risk that I am exposed to, I thought it best to take the vaccine. Now, it could be argued that if you take the vaccine, you could still get COVID, which is true. But from this research that I have done, the vaccines have as much as a 90% chance of blocking infections and transmitting the disease. You have a 90% chance of that being vaccinated. So that is the reason I decided to take the vaccine.
Right. Where you got your shot?
I got my shot at the Carnage Health Center.
And that was smooth and efficient.
Well, it was on the first day of the first come, first serve on Wednesday, which was disastrous otherwise. But I was there on duty, and after the crowd dispersed, I was able to walk in and get mine on the 9th of June, and I'm supposed to return on the 30th of June to get my second shot.
How you feeling now?
Normal. The
No
night,
side effects.
the night I just felt a little more fatigued than usual,
Right.
a little more tired than usual, but other than that, normal, very normal.
All right. Well, my brother, thank you very much. You are one of the people who are watching our backs even while we sleep. And I want to take this opportunity to extend condolences to Trinidad and Tobago Police Service. I just saw another post where you all lost WPC Thomas, and she passed away at the COVAX hospital. We understand you all facing it out there. And my brother, we just ask God to cover each and every member of the Trinidad and Tobago Police Service and Defense Force. Let's keep trying to keep us safe while we stay indoors.
Thank you very much. And you and Natasha, you all keep up the good work.
Thank you, my brother. You take care, right? Stay safe. All right. Bye-bye. All right. So that was Roger Mohammed. You know him as bodyguard. He's a police officer and he took his vaccine and he's all right. So we have on the line now former Commissioner of Police, Jared Wilson. Morning, sir.
Morning,
police?
Yes.
Former Commissioner of Prisons, Jared Wilson.
Anyhow, good morning,
It's
God.
peace.
Good morning.
Yeah, forgive me.
Yeah, that's okay. Good morning, God. Good morning, Natasha. Good morning to the I-95 faithful. Good morning to Trinidad and Tobago. God, before I say when, who, when, why, where, let me say that I think management or yourself should consider keeping this time. I'll tell you why. When I listen to you at 6:15, sometimes I have to break for the 7 p.m. news on television, so it interrupts the smooth flow. So I think there's something you could consider that. I don't know, talk to management. This is a good time.
I hear you.
Listening.
Yes, I hear you. But then Crazy will browse because so they might have to put Crazy in our time. But you never know. They may think about it.
Who knows?
Yes.
How can I assist?
Yes, so why did you decide to take this vaccine, sir?
Well, that is it's a top class question. I'll tell you something. I had my, a bit of hesitation doing it because of all that I was hearing. Sometimes they say a little information is bad and too much is also bad. So when you suffer with Googleitis and you listen to all the comments of persons criticizing the vaccine and people dying, it was sounding as though more people were dying from taking the vaccine than from COVID. So I sat and I analyzed the whole thing and I decided, listen, probably sooner or later I will have to take it. It's the way to go to get at least this immunity. That morning I did the walk-in because my children encouraged me. They told me, they said, Dad, we were going. And I said, all right. So I decided, let me go. And I went to Barataria. It was smooth. I took the vaccine. I got through. It was very professional. Filled out the form and so on. And I took the vaccine. I had no side effects at all. And I'm happy that I did because, it's a means the way to go.
All right.
Yeah.
And so how you feel now?
That I had no side effects at all, so I'm wondering whether the vaccine worked at all. I don't know. I was okay. I didn't have any fever. One thing I was eating more than normal, I was very hungry. But
well, that confirms it because Jillian just said the same thing.
Eating more.
Eating more than normal.
Yes, and so I had an appetite, a healthy appetite. So other than that, I am fine. I hope that I have my second shot on the 29th of June.
Right.
So I hope that also moves smoothly and I should be okay. But I should remind the public though that it doesn't mean getting your first or second vaccine doesn't mean that you need to drop your guard and continue to, you have to continue the protocol. Yes. And that is what I'm doing. I'm still sanitizing. And let me tell you something, Gata and Natasha. I feel that long after, probably, we keep saying post-COVID, when that will come, I don't know. But I feel that we will continue to sanitize and wash hands, till...
We have to.
Yes, I just feel that is going to be a
norm.
Part of the new normal,
yes.
It's going to be, yes. And I think it's the best way to go, the healthy way to do it. That even supermarkets, to wash your hands and things before you go into the supermarket, I feel will continue.
Yes, it should continue. I think it should.
I think so, because there's nothing wrong with it. That's the thing. There's nothing negative about being too clean.
Thank you.
And I want to say, I listen to Mr. Valley, and I want to put in a plug too, because On one of the talk shows, I heard him talk about using the internet and using YouTube to change your position and re-engineer what you do. So sometimes we sit and complain, but out of these this pandemic comes opportunities also. So we just have to change the way we do things. And I listen to him, and he makes a lot of sense because he has been struggling, given the business he's in, and he's doing quite well. So I compliment him for being strong and trying to change the hearts and minds of people.
Yes. So, Mr. Wilson, thank you so much.
Most
and I'm just wondering, that side effects of ethanol, maybe they have a little sativa in the Don't answer that, Mr. Wilson. We go on. Take care.
All right. God bless. Keep up the good work and God consider what I told you, all right?
Yes, all right, sir. Thanks a lot.
Thank you very much. Before we go to the break,
the munchies, Natasha.
The munchies. Well, it may be that it is the body's way of saying, of boosting your immune system, that you have to refuel, so to speak.
Yeah.
Because that tiredness is also a symptom. So maybe it's just your body saying to you, look, you need to refuel. You're going to be a little fatigued, so you need to, stock up. Just to share one comment from Carol on Facebook. She said she was laughing at my mom's experience and her explanation. The only way out of this was doing my research and removing all the naysayers and conspiracy news spreaders. She registered at Digger Martin. I got a call about 9 days after as to when I get my first shot, which was to go to Barataria or Mova. Eventually, they told me to go to the paddock. I got mine the same day as Mrs. Brown. I go back on the same day with her. The organization at the paddock was great, and I complimented them that day and even wrote to their page. I had no aches and pains, no nothing at all. I was called throughout the process. I'm a primary caregiver to my 90-year-old mom. Meanwhile, last year when this started, I've been boosting my immune system. So good for you, Carol.
Yes, thank you very much.
It was a seamless process.
Right. So we're going to take that break quickly. Remember, we'll have Dr. Erica Wheeler live on Facebook with us this morning. And any other questions, any other query, please feel free to drop a line on Facebook, or we will, once we have time, we open the lines and take some of your calls. But when we come from this break, we'll come back with that video I told you about and the young man, Donnell. As I said, Natasha, I'm not familiar with him, but if you see who it is, you'll understand why. And this was done by Base, our media colleague at another frequency at Power 102. But this is his contribution. You can see Base dressed as a doctor, and he, it's a little double entendre, but the main focus here is the message is take it.
Yeah.
Take the shot. So we're going to take a break and return with the video, and then we go straight to Dr. Erica Wheeler, who is already standing by to speak with us this morning. So stay right there, we'll be back.
Just for a while, I'll take it. Let you know she able. Pretend me needle. If you're sitting us, she come for it first. Not to take this vaccine, it could be a curse.
This is reality radio at its best. High on dependency on I-95.5 FM.
Stay at home. Stay away from people. You have been warned.
COVID-19 Conversations with PAHO.
WHO is a public health agency, a global public health agency that we're part of. So they advise we talk glibly about, wearing your mask, washing your hands and all the rest of it, keeping your physical distance and if, how COVID-19 is spread, the fact that it's a virus, it's not bacteria, all of that sort of thing. That is because we have the knowledge and the evidence, and we are the ones that put together those guidelines.
Get the facts. Vaccinate, live. A message from the Pan American Health Organization, World Health Organization.
This is a public service announcement for the Wishing for Wings Foundation and the Trinidad and Tobago Prison Service Inmates Debate Team.
Omega boys, how long may I see you, boy? Come give me a shake on, boy. Boy, one to you, boy, like you are coughing, you coughing in my face, no master thing on one to you, boy. We used to greet with a hug and kiss. Suddenly Corona stop all of this. We have to start to use we elbow whenever we bounce up someone we know. The epidemiologists and scientists class congregation has a great risk, but self-isolation with no events are still being met with stiff resistance. Social distance is necessary to protect yourself from everybody. You have to wear a mask on your face, cause you might come in contact with a case. Washing and sanitizing daily were recommended for your safety. COVID is evil, wicked, and mean, but cannot survive around good hygiene. Protect yourself. Mega say so.
Hello, my name is Marsha, and you're listening to Eye on Dependency with Garth and Natasha, Trinidad and Tobago. Don't you dare traffic drugs. It's not worth it.
Take it, take it, take it, take it. If you see the woman, take it. She sit down back and take it. She tell me.
Thank you for staying with us, and thank you to our listeners on I-95.5 and on our Facebook and YouTube pages. Now, very quickly, let's just go short, man, to the video for Take It, and we will have a look at Donnell,
Yes,
who is featured in the video, and then we'll cross to Dr. Wheeler.
Good afternoon, ladies.
Afternoon.
Where all going?
We're gonna take our vaccine.
Oh my lord, can we come at all at
Of
two?
course.
You take me one time.
Let's go.
Take it, take it, take it, take it. If you see the woman, take it. She sit down back and take it. She tell me she able, pretending it do. Hey, she start to smile. Take it, just for a while. Take it, let you know she able, pretending it do. If you see the nurse, hey, she come for it first. Not to take this vaccine, it could be a curse. Of course, as a first responder, her priorities in order. What made hesitate? Girl didn't want to wait. If you see the woman, take it. She sit down back and take it. She tell me she able, pretending it do. She start to smile, take it, just for a while. Take it, let you know she able, pretending it do. I take a took the she take one drop, I went back for a next drop. She take one stick, I come back cause she love it. She take one shot, I went back for a next shot. She take one stick, I come back cause she love it. Other woman friend, them can make the grade. They say not me and that, this is a charade. But besides a little swelling and a little dizzy feeling, she had me a mess, thinking about her for this. If you see the woman, take it. She sit down back and take it. The woman, she able, pretending it do. Hey, she start to smile and take it. Just for a while, she take it. Let you know she able, pretending it do. I take a took the took. She take one took, I went back for a next took. She take one stick, I come back cause she love it. She take one shot, I went back for a next shot. She take one stick, I come back cause she love it. If you see the woman, take it. She sit down back and take it. The woman, she able, pretending it do. Hey, she start to smile and take it. Just for a while, she take it. Let you know she able, pretending it do. If you see the woman, take it. She sit down back and take it. She tell me she able, pretending it do. Hey, she start to smile, take it. Just for a while, take it. Let you know she able, pretending it do. Take your vaccine, girl.
Thank you, Base, for that contribution that you made to encouraging folks to take the vaccine.
Yes.
And well done. Well done, my brother.
Yeah, because
Well
we
done.
haven't seen or heard from other artists doing the same. So congratulations.
Yes,
to you.
congratulations, B. So let's go now. We give you a brief intro of Dr. Erica Wheeler, who is the Pan American Health Organization, World Health Organization representative in Trinidad and Tobago, Aruba, Curacao, St. Martin, Bonaire, St. Eustatius, and Saba. Dr. Wheeler, a national of the United Kingdom, obtained a master's degree in public health from the University of Leeds, United Kingdom, in 1990, and her doctoral degree from the Newfield Institute of Health at the University of Leeds. She also received a certificate in population studies for health from the University of Chicago, United States.
With over 25 years of experience in both academic study and work in the field of public health, Dr. Wheeler began her professional career as a research officer in the Ministry of Health, Barbados. She was later promoted to the position of Health Planning Officer. At the University of Leeds, UK, she was a research fellow, where she co-managed and published findings of a research project focused on mental health. The report included recommendations to health providers on the improvement of service delivery for persons discharged from acute psychiatric care.
Dr. Wheeler joined WHO Geneva in 1999 in the Department of Mental Health and Substance Abuse. After this assignment, she started a tenure at the WHO office in Indonesia in 2003. During the post-disaster period of the Aceh province, in the Aceh province, sorry. In December 2007, Dr. Wheeler rejoined WHO HQ as Knowledge Officer in the Global Health Workforce Alliance. From 2010 to 2015, she served as Technical Officer Health Workforce, where she led the Global Program for Health Workforce Education and Training. In this role, she was responsible for the publication of the first WHO Global Guidelines on Transforming and Scaling Up Health Professionals, Education and Training in 2013.
Dr. Wheeler served as Advisor, Human Resources for Health in the Office of the Sub-Regional Program Coordination Caribbean from 2015 until her appointment as the PAHO WHO representative Trinidad and Tobago on the 8th of September 2018. In her current role, she oversees technical cooperation to advance PAHO's public health agenda in Trinidad and Tobago, the Dutch territories and municipalities of Aruba, Curacao, St. Martin, Bonaire, St. Eustatius, and Saba.
Dr. Wheeler, thank you very much. And I'm sure you're listening to that and probably asking yourself, how did I manage to do all of that?
Good morning. Good morning to everyone. It's such a pleasure to be on the program, and you really took me back a long time ago with that. Yeah. I feel 20 years older now.
Yeah. But yeah, that's a lot of work, Doctor. And we want to thank you very much for your contribution to humanity. And we thank you very much for accepting the offer to speak with us this morning, because this concerns all of us as well. So we get right into it.
Yep. Let's start by talking about vaccines. I mean, you may not have heard what came before, but we had a couple of citizens describing their experience with the vaccines that are available here in Trinidad and Tobago. So tell us, how do vaccines work, first of all?
Okay, so thanks again for the invitation. And I know this question about how vaccines work is really critical, because a lot of people are worried that there may be things in vaccines, or the vaccines have been developed too quickly. So vaccines, basically, they work because they stimulate a response by the immune response by the human body to the invader, which is the pathogen. The pathogen has something really small in it called an antigen, and vaccines are developed in different ways. There are about 4 main ways in which vaccines are developed, and they're developed to introduce this antigen into the human body to stimulate that response. And vaccines have been around for a long time. We have the measles, mumps, and rubella vaccine. We have tetanus vaccines. So when vaccines are developed, they use the whole virus. In this case, now we're talking about COVID-19, but of course it is treated in a way that it's not harmful to the human body. So it could be delivered into the human cells that then react to this protein, this antigen that's been delivered, and they develop what's called antibodies. You've got the, so you can have also a piece of the virus, not necessarily the whole virus. You can have a little piece of it that's introduced into the human cells, but it has the same effect of stimulating an immune response. Now you have the new type of vaccine, the messenger RNA vaccine, which Pfizer-BioNTech and Moderna has used. And they use a different procedure to introduce this protein into the body. But none of the vaccines are harmful, just as we've been having vaccines for decades for all types of diseases. These new vaccines for COVID-19, and I say new, and I know the messenger RNA, is a new way of delivering the vaccine to the human body to stimulate that immune response. It's been in the process of development for some time because we've had SARS and we've had MERS. You've heard of SARS before, the severe acute respiratory disease, and there was already work ongoing on it, but it had not reached the stage of clinical trials. But because there's been so much front loading in research and development, because of COVID-19, they were able to advance the technology. So it didn't spring out of nowhere. So basically, I mean, keeping it simple, vaccines are developed under very close supervision for quality, safety, and efficacy through clinical trials, starting on animals and going all the way up to humans, in the sense that you start with hundreds of people. There are 3 phases of the development of vaccines. The first phase, you have hundreds of people. The second phase, you have a few thousand. And by the time you reach the third phase of clinical trials, you can have 40, 60, 100,000 people, sometimes from different parts of the world, participating in these trials. So you know by the end of it, it's been tested on a vast array of people. But as I said, there are 3 or 4 different ways of delivering these little antigens, these proteins, into the human body that stimulates that immune response by the body. And that's how vaccines are basically developed. I mean, we can have another program on that.
Yes, very extensive. And I mean, you already covered one of the other questions I had about the recent development of these vaccines. But as you mentioned, it was already in the pipeline, so to speak, with the other coronaviruses. But explain to us how many different types of vaccines there are, because I know people are accustomed to getting their measles, their mumps shots. How are those kinds of vaccines different to a COVID-19 vaccine?
Well, actually, some of them are not different from the COVID-19 vaccines. It's basically the messenger RNA. So let me go over that again. So using the whole virus, there are 3 different types of ways. It's something called inactivated vaccine, or you can have a live attenuated vaccine, or you can have a viral vector vaccine. So for the inactivated vaccine, you use the virus and you kill it by heat, chemicals, or radiation. For example, the flu virus or the polio virus. For the live vaccine, it's living, but it's a weakened version. For example, measles, mumps, and rubella vaccine. Or you can have the vaccine where there are little parts, subparts of the germ that's used to insert into a safe virus to deliver to the body. And this stimulates an immune response. So that's one method, using a whole virus. Then there's a second method, using parts of the virus that trigger the immune response. This is called a subunit approach. And I feel as if I'm doing a session now. Yes. So this only uses parts of the virus, and the immune system can recognize it. And most of the childhood schedule of vaccines are like this. You have tetanus, diphtheria, and meningococcal meningitis vaccines, for example. And then there's a third method using genetic material, okay? And this uses a section of the genetic material that provides instructions for specific proteins, the DNA that your body is made up of, and the RNA. And these instructions are given to our bodies to make these proteins. And then our cells, inside of our cells, the DNA is first turned into the messenger RNA, and this is used as a blueprint to make the specific proteins that the body then reacts to. But all of that is basically to say there are different methods of developing vaccines. All of the rest of them, as you would hear, I mentioned measles, mumps, and rubella, flu vaccine, all of these vaccines that we've been taking for a very long time. It is just the messenger RNA vaccine, the Moderna and the Pfizer-BioNTech, that are the most recent and new ways, but all of the rest of them are quite common. So there's nothing strange about the development of these vaccines. So there are different platforms, for put it that way, to develop vaccines.
If you're just joining us, you're listening to Independency, and we are speaking with Dr. Erica Wheeler. As you know, she's the Pan American Health Organization, World Health Organization representative here in Trinidad and Tobago, and she's taking us through the paces here this morning. Some of the questions that you may have, you will get them answered as we go through this morning. And also, you have any other question, you can send them to the Facebook chat on the Independency Facebook page, YouTube, or we hope we can take some of your calls before we wrap up with Dr. Wheeler. Now, Dr. Wheeler, again, for the public, do vaccines protect against contracting COVID-19?
Okay, so that's a really good question, and I know it's something that people are worried about. So what the vaccine does, you can still, for example, if you have two persons and they're both vaccinated, okay? If someone who has not been vaccinated, they can still infect a person because right now there's still transmission. But what will not happen, and there's been sufficient proof and evidence so far, is that you will not develop the disease COVID-19 so severely that you end up in hospital, or you will not die. So it is not a cure per se, but it is a protection against severe disease and death. And even, of course, long-haul COVID, which we don't talk enough about, because you can have COVID if you're not vaccinated, and you may not recover fully for a long time. And we are not sure right now how long some of those after effects may last. And that's called long-haul COVID. So the best protection is to take the vaccine.
Right.
And you can't, sorry.
No. So then should vaccinated persons still observe health protocols?
Absolutely, 100%. Because the one thing you do not want to do is to, in terms of, okay, so you're saying I'm vaccinated, so why should I bother not to wear a mask? Why should I bother to keep my physical distance? But you have to remember what I just said. There can still be transmission. So why would you want to transmit it should you unfortunately still contract it, although you would not, as I said, become severely ill or die? You may have something very slight, a runny nose, something like that. But still, why take that risk? Because there are some people whose immune system, at this stage of the development of the vaccines, there are some people whose immune system, they may not be able to take the vaccine. And you then can put those people at risk. And so until we reach herd immunity, where sufficient percentage of the population has been vaccinated, then of course you don't want to be transmitting COVID-19. Remember, this is a new virus. It's not SARS or MERS, it's new. And we are still at a stage where we are learning more and more about transmission, about severity of disease, and about the variants. So yes, you must continue to observe public health measures, certainly in the situation here in Trinidad and Tobago, where we are nowhere near herd immunity. So there's still a significant percentage of the population that is still vulnerable to contracting COVID-19. So you still want to observe all of the public health measures. And remember, children are not yet vaccinated, so you can still be at risk of transmitting it to children. And why would you want to do that?
Yes. So before we get on to COVAX and ACT, we had a question from one of our listeners / viewers about, and I'm not sure if you can speak to this, but if you can, please do. What, if any, are the human rights implications of people being mandated to take the vaccine? Or is it, in your view, in the view of of PAHO WHO, that it is a choice?
Oh, well, definitely in the view of PAHO and WHO at this stage, it is a choice. We have never said that it's mandatory, but we don't have control over what sovereign governments might say. For example, they might say you can't come into my country unless you're vaccinated.
Right.
And in some parts of the world, for some companies, they may be private companies, they may say you can't come back to work until you're vaccinated. We don't have control over the decisions of countries or organizations, but we have not said it's mandatory. We are trying to encourage people on public health grounds and to protect health, safety, and the loss, and stop the loss of lives, to encourage people to take the vaccine. But it is not mandatory. But you also do know that before children go to school, there are certain vaccines that it is mandatory for them to take. And that is something that sovereign governments decide. But we have not said that it must be mandatory.
If you're just joining us, you're listening to Independency, and we are speaking with Dr. Erica Wheeler, and that's the PAHO WHO representative here in Trinidad and Tobago, and she's answering some questions, some that you may have. If you can still join us on the Independency Facebook page, YouTube channel, and of course on I-95.5 FM and the Facebook page as well. So we go to the COVAX question now.
Yes.
Doc, what is COVAX?
Yes, excellent question. So COVAX is the first, it's called the COVAX facility. It is the first facility ever developed in the world to facilitate fair allocation of vaccines. That's the aim. I'll talk about the problems with it. But also to ensure that in all countries in the world, whether they be upper income, middle income, or lower income countries, get 20% of their population vaccinated by the end of 2021 by securing 2 billion doses of vaccines. So it was set up in order to ensure that there are enough vaccines to end the acute stage of the pandemic. It comprises the World Health Organization, Gavi, which is the Alliance for Vaccines, and something called CEPI, the Coalition for Epidemic Preparedness and Innovation. And together they make up the COVAX facility, and it is led by Gavi with support from WHO for all of the necessary pre-qualification, emergency use listing, and so on for vaccines as well. So this facility was set up with that aim in mind. Now, I want to say a little bit more, which is when the facility was set up, it was not perceived that there would be such a high degree of bilateral arrangements for purchase of vaccines outside of this facility, because of course all countries were invited to join, and right now there are 190 member states out of the 194 of WHO member states that have joined the COVAX facility. And many of the high income countries have actually contributed large amounts of money in the billions to advancing the development of vaccines. It started in countries such as France, the UK, US, Canada, and so on, because that's where the big vaccine manufacturers are. That is the reality. But they were pre-funded to accelerate the development of vaccines through COVAX. And all countries that subscribed to COVAX, some of that funding went towards the research and the development for the vaccines, given that we are speaking about a pandemic. So, but unfortunately, some of those same countries pre-purchased very large quantities of vaccines, so that when the vaccines were produced, we find ourselves in this situation globally now that many of them were already pre-purchased and therefore went to some of the world's richest countries. However, because COVAX has still secured sufficient quantities, many countries were still able, not all 190 to date, but most of them have still been able to get some percentage of vaccines, starting with 3% of the population, which includes the health workers and the frontline workers, and then going on from there. You could see, for example, what's happening in Trinidad and Tobago. But there is a global shortage of vaccines as a result of this pre-purchasing, and of course, some problems they've had with having to discard some vaccines because of the conditions under which they were developed. There were problems, mistakes by workers, not to do with the quality or safety of the vaccines.
Can you say that COVAX has been working then in terms of the vaccines that they have been able to deliver to certain countries, including Trinidad and Tobago?
Well, they have been working, but the hands of COVAX has been tied by the behavior of the large wealthy countries that have pre-bought so many vaccines. But you have to remember, if we didn't have a COVAX, how would we have gotten vaccines? We would have to wait on donations. You heard the Prime Minister say time and time again that they tried since last year to buy bilaterally, to purchase vaccines, but the vaccine manufacturers were not selling because they had already committed large quantities of vaccines previously. So small island states like ours and many poor countries in Africa, there's no way they could have afforded to get vaccines were it not for COVAX. In addition, as part of COVAX, they have a special arrangement, what they call for advanced market commitment countries, small countries that could never afford to buy vaccines, some of whom are in the Caribbean, incidentally. And as a result of COVAX, they were able to get vaccines through the COVAX facility at the same time as countries like Trinidad and Tobago and others. And if you follow the information, you would see, yes, we got smaller quantities than we wanted, but that's because there had to be a fair system of allocation, because we are talking about global distribution to 190 member states. So if you're looking at countries that can't afford to buy at all, with countries who can buy 5 times as many as they need, you can see already there is vast inequity. What COVAX tried to do was to level the playing field. Of course, it was not successful completely. Why? It is because of the behavior of countries with what the Director General has called vaccine nationalism, which he is speaking out against. And now you see there's beginning to be a turn in the tide where some of the larger countries, we see the USA saying that they're going to be giving 80 billion doses of vaccines out over, this year and next year. So also just think about it. If we were vaccine manufacturers in Trinidad and Tobago, wouldn't we want to serve our country first before we gave to others? So there are political as well as humanitarian issues and issues of equity all tied up in the distribution and the fair allocation of vaccines. But COVAX has stuck to what it has always intended to do, despite the actions of big member states. And everybody now is entering into bilateral deals. But the more you take out bilaterally is the less you have available in terms of equity and fair allocation in COVAX. But the discussions and the work continues with COVAX.
If you're just joining us, you're listening to Independency, and we are speaking live she joined us by Facebook, Dr. Erica Wheeler, who is, of course, as you know, who is the Pan American Health Organization, World Health Organization representative here in Trinidad and Tobago. Now, Dr. Wheeler, we've been hearing about the ACT Accelerator. Many times we've heard that come up. So could you explain what is the ACT Accelerator?
Okay, so the ACT, we call ACT Accelerator for short, is the world's most comprehensive end-to-end solution to end the acute phase of the pandemic. So it brings together governments, health organizations, scientists, businesses, civil society, philanthropists to accelerate the development, production, and equitable access to COVID-19 tests, treatments, and vaccines. So it has three arms. It has the diagnostic arm, which is the PCR test that we use to test for COVID-19. And it also has what's called rapid antigen tests, some of which we have in Trinidad and Tobago right now that will be rolled out. So there are those rapid tests as well. There are the treatments, which would be the therapeutic treatments. That has lagged a bit behind. So we don't have, apart from the use of dexamethasone, there really are no treatments that have been sanctioned, approved based on clinical trials by WHO. There are promising therapeutics, but at this stage, vaccines is the best option. And of course, we have vaccines, and we're just talking about COVAX and what COVAX is doing. So that's it. The tests, the treatment, and the vaccines are the three components of what's called the ACT Accelerator or ACT Accelerator, and it stands for A for access, C for COVID-19, and T for tools. And the idea behind acceleration is that idea that countries and governments of the world have come together to speed up the availability of tests, treatments, and vaccines. It is not a legal body. It is not a decision-making body. It was a framework and is a framework for collaboration, and it was set up in response to a call from the G20 leaders since March last year and launched by WHO, the European Commission, France, and the Bill and Melinda Gates Foundation. Since last year, April, it was launched.
So Doctor, who will get access to the tools developed as part of the ACT Accelerator?
Everyone and anyone. For example, let me give you an example of the when we're looking at therapeutics, okay? There's something called a global solidarity trial. 120 odd countries around the world are part of it, that's where they've tested hydroxychloroquine, for example, and found that there's no benefit from using it. That's where they've tested various other drugs that may not mean anything to you, but like remdesivir and lopinavir and others. It's where there's a rage in the discussion about ivermectin, whether it's effective or not. So across the world, these trials are taking place, and you would be interested to know that Trinidad and Tobago is part of it, or University of the West Indies is part of it, because when this started and I found out about it, I informed the University of the West Indies, and they have been participating in this. So any country who is interested can be part of the clinical trials for that part of it, for the therapeutics. Of course, then, because the ACT Accelerator has those three parts, the vaccines, that's global. We've just talked about it. So we are benefiting from it. It's a global effort. And of course, when it comes to the diagnostics, we are benefiting because we have PCR tests. And we also have the rapid antigen test that will be rolled out. So the whole world, this is for the whole world. It's not for specific countries. So it is a framework. And the goal of it was to end the COVID-19 pandemic as soon as possible and to prevent severe disease and mortality. So this is why the ACT Accelerator was set up. So it's just those three aspects: diagnostics, therapeutics, as well as vaccines. So everybody in the world can benefit from it.
Have there been any successes recorded from this this alliance as yet?
Yes, we have the vaccines. Yes, we have PCR tests. Yes, we
Right.
have antigen tests. The only thing that, as I said, that has lagged behind is the therapeutics.
Right.
And there's work going on constantly in clinical trials to see what therapeutics can be effective. So we have had the PCR, the antigen tests, and the vaccines, which are all part of it. And there are 9 organizations involved in the ACT Accelerator. They may take different leads in different areas, but there are 9. There's the World Health Organization, there's the Coalition for Epidemic Preparedness and Innovations, there's Gavi, the 3 of which are part of COVAX and lead. There's the vaccine, there's the Global Fund to Fight AIDS, TB, and Malaria. There is Unit A, there's the Foundation for New Diagnostics, called FIND for short. There's the Wellcome Trust, there's the World Bank Group, and there's the Bill and Melinda Gates Foundation. So this is a global effort.
Indeed. Well, it's very it's very comforting to know that this work is happening on a global level. We may not be aware of how it impacts us individually in our countries, but it's reassuring to know that that there is this level of cooperation happening at a global level to deal with this pandemic. We do have a couple of questions from our Facebook audience, if you up for that, Doc.
Of course.
One question, Heather asks, what is the main difference between the AstraZeneca and Sinopharm vaccines in relation to the percentage of protection and the contents used in developing them? Is there any difference?
Okay, so let me go first to the contents. All vaccines have something called surfactants, which they keep the ingredients of the vaccine blended together, and they prevent settling and clumping of the elements that are in the liquid form of the vaccine. And they're used in things like foods like ice cream. There's something called residuals, which are tiny amounts of substances used during manufacturing or production, and they're not active ingredients. They vary according to the manufacturing processes, but it could be egg proteins, it could be yeast, or it could be antibiotics. There is something called an adjuvant, and some vaccines use them and some don't. Some contain these adjuvants, which improves the immune response to the vaccine. And this is used in the AstraZeneca vaccine, for example, and in the Sinopharm vaccines. And they may keep the vaccine at the injection site for a little longer, or by stimulating a local immune response. And they're very tiny amounts of aluminum salts, for example, that are used in them. And the rest of it is, as I said, you can have a piece of the virus, you can have the whole virus, which is killed, or you can use the messenger RNA. So for I'm just having a look here at my notes. For the Oxford AstraZeneca vaccine, it has an efficacy of 82%, and also against what we used to call the South Africa strain. They've been renamed. And similar to Sinopharm, it's a 2-dose vaccine, okay? It's made, it uses the spike protein to introduce into the body to stimulate the immune response. We haven't got the Johnson & Johnson yet, which we are hoping to get. With the Sinopharm vaccine, whereas the Oxford AstraZeneca is what we call the viral vector vaccine, which I spoke about earlier with the little pieces. The Sinopharm vaccine is a whole inactivated virus. And the efficacy is 79%. And also it has some efficacy against the South Africa strain, as well as the US and the UK. And I really need to say that we have changed the names, but I know this is of the strains. I know this is what people are most familiar with. This has a slightly shorter period of time between which you get the vaccine. It's 8 to 12 weeks for AstraZeneca, but it's 21 to 28 days. But in terms of the ingredients that I just named, they're very similar. So there is no chip in the vaccine, there are no magnets, is nothing like that in any vaccine ever created for the human beings. That just doesn't happen. If you know sufficiently well what is the process that goes on, and all of the vaccines that have emergency use listing by WHO actually sends teams of people to observe the manufacturing site, so they know under which conditions the vaccines are produced. They have to open their books to be assessed, and it's called a rolling assessment. So as information is provided, it is poured over by scientists and epidemiologists and so on. WHO has hundreds of people in different parts of the world working on this, and all the data must be opened. You can't hide anything and get emergency use listing. And normally these vaccines also get approval by what you call stringent regulatory authorities like FDA, the Food and Drug Administration in the US, the EMA, the European Medicines Agency for Europe, and also the one in the UK. So they go through that national phase first by a national regulatory authority, and then they come to WHO, and they ask WHO to be included in COVAX. We don't ask them, they ask us. Excuse me, and that's the process. But in terms of the similarity between the vaccines, one is whole, one uses a little part of the virus, and all of the other things I mentioned, such as the adjuvant, and Pfizer, which we don't have, has something called a diluent, which just helps. You have to mix it's just saline, sterilized saline solution that allows you to mix the vaccine because it's frozen. So just before it is administered, it is mixed and then it is administered. So there's nothing harmful in the vaccines in terms of the composition of the vaccine.
Right.
We have.
Go ahead. Sorry. Go ahead.
No, we have a couple other questions, but we'd like to open the phone lines if that's okay with you, Doc. 622-3937 is the number to call if you have a question for Dr. Wheeler, who again is the PAHO WHO representative in Trinidad and Tobago.
And if you're wondering, you listen to Independence. I know it's a strange time for most of you to have us on now, but as you know, because of the curfew being pushed back to 7, we have to do this morning until the end of June, I think, and then we will see what happens from there. But for now, we are here this morning. And for those of you who are wondering, and those of you who have missed this morning for some reason, we'll have a repeat on our Facebook page this evening from usual time, 6:15 p.m.
Yes, we have someone on the line. Good morning.
Hello, good morning.
Yes, sir.
Is this COVID a biological weapon?
All right. Thank you very much for that question. We won't be able to answer that, and the doctor won't be able to answer that. And let me remind you all, please.
The answer would be no.
please be respectful to our guests and to our guests, and please ask a relevant question to so that the doctor can answer it in the little time that we have. All right. I beg of you, please be respectful. Whether it be a biological weapon or not, we would know that, and I'm sure the doctor would not be in a position to answer that question.
Good morning.
Yes, good morning.
Morning, doctor, and thanks for the information. I have 2 questions. I understand, and was hearing that on one of the foreign news broadcasts that the Sinopharm, the Chinese vaccine, was they built their vaccine around a particular phrase, old technology. In other words, how they would normally build vaccines. And as I understand it, the other pharmaceutical people, they like Pfizer, and they use a different form of technology. Could you explain that to me? One, and the other question is, why are we not hearing about Sputnik? I mean, the Russians were the first to come out with their vaccine, and everything else is being promoted excepting that. Is there a problem with Sputnik, or is Russia just their vaccine is just not being promoted for whatever reason, financial or whatever? Thank you.
All right, thanks.
Thank you. Doctor, do you hear those questions? Can you?
Yes, about different forms of technology, yes. And that was the point I was trying to make. There are 4 different ways of developing vaccines.
Yes.
And as I was mentioning before, some of them are indeed more traditional, like the methods you use for developing the tetanus vaccine or the measles, mumps, and rubella vaccine. So those are the more traditional ways of developing vaccines. And yes, it's very observant that you can see that the messenger RNA, which is the technology used for Moderna and Pfizer, is different and it is more recent, but it is not brand new out of the blocks because there was already work going on. As a result of SARS and MERS, scientists were already working on developing a vaccine, but it had not been as advanced as it could be now because there was so much money put into research and development in a short period of time to bring it from where it was to the stage where it could be tested on humans. So it is true that there are different platforms for developing vaccines. Some are more traditional, and the one with messenger RNA like Pfizer is more recent. So, for example, the one with using little parts of the germ, that was what they did for the Ebola vaccine. But for the Pfizer BioNTech, it is the messenger RNA, which didn't use the virus. It used a different method to introduce the antigen into the human cell to stimulate that immune response. And as for Sputnik, it is being reviewed. There has been a start, but you have to remember what I just said, which is WHO does not go looking for vaccine manufacturers and say, you have to give me your data so I can decide whether it needs to get an emergency use listing. The manufacturers have to apply to WHO for what's called, they have what's called an expression of interest. And once they have that expression of interest, then they have to provide the information. So if they never come to WHO, we will never be able to assess whether the vaccine is of good quality, safe, and efficacious. But I understand that they have approached WHO, but they have to provide the information to complete all of the data that's necessary before they get an emergency use listing, which means it can be used anywhere in the world safely. So any vaccine that reaches stage 3 clinical trials and applies to WHO will be considered, and there are over 100 such vaccines right now.
Gotcha. I realize the rain has begun to fall in where you are. where you are. So I'll just meld these last final 2 questions into one, and we can wrap up. In terms of reactions to the vaccine, if someone has what we would consider a comorbidity, or like for instance, a stroke, or if they have allergies, how should they proceed in terms of making the decision to be vaccinated?
Okay, so people with comorbidities are particularly prone to severe disease of that. So they must consider having a vaccine to protect themselves. But should they be worried for any reason whatsoever, the best thing to do is to speak to their doctor, speak to their GP. This is normal procedure if you have any concerns, for example, about your allergies. But so far, there's no contraindication to persons with comorbidities having the vaccine. And you would see that, in fact, something called SAGE, which is the strategic group for epidemic, for information on immunization, that WHO works very closely with. It's an expert group. They recommend that people 65 and over and people with comorbidities be the priority groups to be vaccinated because they are more likely to develop severe disease and or die. 15% of people who get COVID-19 develop severe disease and 5% die. and people with comorbidities tend to be in those two groups, that 15% or the 5%.
All right, Dr. Wheeler, it's been a pleasure.
Yes.
I can hear it's raining a lot by you, so I think you should make use of that by getting under the covers after you speak with us if you have to.
Can I just say one more thing?
Sure,
That
sure.
I wanted to share.
Sure.
I wanted to share something too. I know there's been a lot said about what's in the vaccines and they're not safe and maybe they want to affect people's fertility, etc. But just last week, Trinidad and Tobago, like many other countries around the world, have been invited to be part of a global group of countries who can develop the capacity in the future to develop the messenger RNA vaccines like Moderna and Pfizer in their own countries. So this is something that WHO and PAHO is encouraging and will work with countries to develop that capacity, because the idea is that we are not caught in a situation in the future where only a few countries have the capacity to develop their own vaccine. So I think that's important to know, because that will also address the issue of people feeling that it's, all these foreign people that are trying to harm us. But the technology is there and it needs to be transferred and shared globally. And many of those countries with the technology have agreed that they want to share the technology. So I know UE was on that call. I know the government is on that call. So we have to look to the future for what is possible for us in the Caribbean and in Latin America. Thank you.
Dr. Wheeler, thanks again.
Thank you so much.
Thank you so much. Though you really have busy schedules from now, you don't know when it's going to come to an end, but we look forward to it, at least, being relaxed at some point. Thank you. And is it possible I can ask of your communications department to visit our Facebook page as well, and if they can answer some of the questions that the audience would have posed during your interview, so that at least people ask questions. We hope that we could answer all, but sometimes time runs out on us and we can't get to do that. So if it's possible, you can ask your comms department to answer some of these questions for us, please.
Of course.
God bless you.
Thank you again.
Thanks again.
Bless you too. Thank you.
Stay safe, all right?
Have a wonderful day. Yes.
Okay, you too.
Bye-bye.
Bye-bye. That was Dr. Erica Wheeler, the Pan American Health Organization, World Health Organization representative here in Trinidad and Tobago. And as you see, Shortman, we had two things to do on behalf of the counter trafficking unit and the Ministry of Labor. So could you put up that picture with the counter trafficking unit and we just share with the listener?
Yeah, that's D.
Yeah, that's D. And this is about two Venezuelans were charged. There they are. Two Venezuelans have been charged for the following an intensive investigation by the Special Unit Investigations Unit Special Task Force with the assistance of the counter trafficking unit and Interpol. Pedro Davis Hernandez, 29, was charged with the following: transporting a person within Trinidad and Tobago for the purpose of exploiting that person for prostitution, contrary to Section 23 of the Trafficking in Persons Act, and procuration for the prostitution, contrary to Section 17, Sexual Offences Act. And the two accused appeared virtually at a virtual hearing before Port Street Magistrates Court, and that's on June 9th. And of course, bail was denied. So once again, the counter trafficking unit and other agencies, based on intelligence and following a painstaking inquiries and surveillance, officers with the assistance of the Northeastern Division Task Force intercepted two vehicles from Bamboo Settlement Number 2, Valsade, transporting 9 Latin American nationals, inclusive of a minor. 2 Trinidad and Tobago nationals were also arrested. So even the pandemic is not stopping Natasha. They're not stopping them at all.
Crime is not going to stop on account of the pandemic, and we're glad to know that our law enforcement agencies are on top of it and investigating while we are on lockdown.
Yes, Ms. Wheeler, and of course the other units. And this is Alana Wheeler now, not Dr. Wheeler. This is Alana.
No
Wheeler.
relation.
No relation. and of course the Ministry of Labor, they have a calendar of activities to end child labor 2021, which is one of the commemorative activities. Would you be interested in? Well, we ask you to visit the Ministry of Labor's Facebook page and there are a number of things that they're going to do in commemoration of the International Year for the Elimination of Child Labor. So visit their Facebook page and you will get more information. And they have a number of activities that you can get involved in, and like a pledge video and newspaper call. I mean, all of these things, virtual art showcase. Hey, this is going to be fantastic. So visit the Ministry of Labor's Facebook page, and you will learn a lot more of what is asked.
Yeah, I just tag them in the chat on the Facebook page,
Right.
so you can
Probably could take
have a look then.
one or two calls before we go. And Shopman, you could remember, folks, we're here in the morning until the restriction lifted. Some people are recommending that we stay at this time.
Yeah.
Tell us what you think. You never know, because we have our movie to show, and I was thinking we couldn't show that movie on a Sunday morning. But the World Day Against the World Day Against Drug Abuse and Illicit Trafficking is coming up, and we want to find out, would you like to see traffic? We can show you it. Let's hello, good morning.
Good morning.
Morning.
I'd like to ask Dr. Wheeler if your platelet level is 100, if it's necessary, take the vaccination. Because my husband went in the health center and they told him to take blood test because they find the platelet was 100. But he's wondering, he want to take the vaccine, but not have him disturbed.
Okay, so all right, we'll send that question. Natasha could ask that question online so that when the platelet level is 100 and the person wants to know if it's safe for the husband to take it. So we just have about 3 more minutes left. Hello, good morning.
Good morning.
Morning.
I have an observation. How is it that the vagrants do not wear masks, they do not bathe, they do not sanitize, they do not wash hands, they sleep on dirty concrete, they eat from dustbin, they have underlying sicknesses, they have mental problems. And how come they are not getting the corona and they are not dying from it? Is it that they are overplaying the corona? Because they are the first ones supposed to be getting it.
All right. Well, I think Jesus can answer that. Yes, friend, I don't even know. I don't know how.
I think having lived on the street, their immune systems are probably better than ours.
Yeah, and I working out every day, and them are real 6-pack abs, and I trying to get 6-pack abs like them. So we take one more. So I can answer that. It's very straight. Hello, good morning.
Good morning again, Garth and Natasha.
Morning.
Their body are immune to what it is they're surrounding with. No,
really? Because they're still alive, right?
Because look at, and they say pigs have this germ in them, the worm in it, and they live with it. That is what the pigs eat, especially, the pigs who not living in farms, who live and eat from the mud and the dirt and all those kind of things. And even though those people who are vagrants and on the streets, they don't intermingle with society, because if you see a vagrant who lies on the you would move away from them.
Of course.
So if you have it, they would not get in contact with the virus. Yeah. And when they say they clean the streets, Garth and Natasha, the streets is be clear, all of this one bathe and change your clothes and get good clothes and put on. I noticed that in Narima. You see, when they had the lockdown, you don't see a vagrant on the street. And when they come out back, they clean and they're nice looking. So they had a home to just go in and bathe and change your clothes and what, and trying to get from you and me and everybody else. I'll leave it now. No time is short.
All right, yeah. And Ms. Wheeler said, so Alana said, vagrants have strong immune system.
Yes, they do.
And you could line up a vegan and go in a dustbin. See who will survive that. No?
But at the same time, that being homeless is no way to live. So we shouldn't glorify it.
Folks,
and right.
We have to go. We'll have to share that video again from the Ministry of Labor next Sunday. And we'll share it on our Facebook page. But we'll be back again with you next Sunday, God's willing, for another edition of Our Independency. As I said, a lot of people are asking us to keep the time here, Our Independency at this time. Well, we'll have a discussion in management and see what happens. That's entirely up to them. So up next, still in Henderson with the 12 o'clock major news, and